So here with helpful ways to prevent that lower back pain, we welcome back wellness expert, Dr. Paul Reed. You couldn't be here on a better day.
Uh-oh, are we suffering a little bit?
Well, I was a little this morning. I got out of the shower, I reached for the towel, and man, all of a sudden I could almost fall to my knees. There was like this pain that went, and it sounded like that. No.
Some superhero.
Yeah, exactly. Like right in my lower back. And I was like, oh. And then I was like,
right, so our segment, right?
Okay.
2/3 of America suffers from some sort of back pain, which is primarily mechanical, meaning the joints aren't moving right. So
okay. Yeah, what's the other part though? Can hormones be involved? I'm curious.
Probably not with the back pain, unless it's a referral. Well, I mean, if you have something more organic going on, if you got some
issue, because I mean the lower back, that's all connected in that lower region, and sometimes I just feel like sometimes that lower back pain, depending on the pain, it comes and it goes, and it's like, what happened? Yeah. Well, anyway, that's another segment. So tell us how we can prevent some of this, or at least alleviate.
So the first thing we want to talk to people about is so people historically think, oh, my back hurts, I should go lay down on the couch, lay down on the bed, and not move. And that's one of the worst things that we could do. It's one of the one thing to not do, unless it's like you fell off the,
Right.
I'm hanging the Christmas tree lights and I fell.
Yeah.
But for mechanical back pain, we don't want to go sit or lie down to increase that. So think of yourself as an athlete. So today, if you're watching any sport, if a professional athlete gets hurt, they don't just sit. They start to get them an active rehab where they're moving as soon as possible, because our body heals when we're moving. So the last thing that we want to do is just go, I'm going to go lie down on the bed and check out, and hopefully this goes away, because it's not.
Well, good thing I didn't do that this morning. I wouldn't be here with you right now. Right? But now here's something else though. I did try and start kind of doing some of this. So stretching is okay?
Yes. So we want to, again, that's adding movement. So doing some stretches to increase that range of motion in those joints, again, to restore function to help them be as healthy as possible.
All right. And then you say another tip is to find out what the cause is or what makes it worse.
So again, if it hurts, don't do it, right? So, Mom and Dad taught us that if the stove is hot, don't put your finger on it, right? So same thing. If there's a pattern in your life or work habit or workout habit that's creating that pain, then let's find some strategic ways to avoid increasing that pain. So basically, don't go back to that same habit and don't push through and work through that.
So we don't put, because the instinct, you say don't lie down and relax on it. But then you say don't work through the pain either.
So find an alternative. So if this one specific movement is increasing that pain and it's troubling you throughout the day, then find a pattern or another way to do that without increasing.
Oh, okay. And what kind of role does our posture play?
Huge. It's everything. Posture is the window to our health. So we have to have healthy, right? So
as I'm saying that, I'm trying to straighten it up here, because I know I can't help it sometimes.
So many people slouch, and we want to support those normal healthy curves that our spine is designed to have, but our bad posture is technology, right? We've done our segment on forward head posture and whatnot.
Yes, absolutely.
Right, so that stuff over time is going to compromise the joints and the muscles and then cause that chronic pain that you're experiencing.
So what about wearing particular shoes? Is it okay to wear high heels?
So in moderation. We got a date night tonight. You and hubby want to go out and want to look sharp, then that's okay. But I wouldn't recommend them every day, all day on your feet.
See.
If you're sitting, then it's okay. But if you're on your feet all the time, that's going to rotate that pelvis forward, which is going to put you in some hyperextension and jam those joints up.
Oh, that's not good. Okay. So what about any kind of thing we can do, like maybe every day, to make sure that we don't get the back pain, like when we get up in the morning?
So get up and move and stretch.
Okay.
So if you look at any animal, right, what's the first thing your cat does when it gets up in the morning?
Oh,
it
yeah.
stretches, right? It's got, I got to stretch, right?
Yeah.
So they're increasing blood flow, moving those joints. So we're essentially no different. We want to stretch and move, get some water to hydrate those tissues.
Okay, I have water by the side of the bed, so I can do that.
Perfect.
But you're trying to tell me when they're screaming for me in the morning, Mom, I need this, not to jump right out the bed and say, you have to wait.
Right,
Dr.
Mama's
Paul
got to stretch.
I got to stretch it out.
I need my breakfast now.
This is good though.
Yeah, it's like warming up, right? So it's
you got to do, but it's also like, I think the other day, just yesterday, we were talking about self-care here, and that's part of it, right?
100%.
Like you want to jump up and you want to go take care of everybody else, but you don't take the time to take care of yourself. So what is that? A couple, like even a 1 minute in the morning?
100%,
It doesn't even take that
Just
long.
a few seconds.
Yeah, we can do that. Okay, what about heavy lifting?
So, I mean, again, done properly is okay, but most people aren't lifting things in the correct manner, and so then they're breaking down a joint.
Cassie, he's talking to you.
She's throwing somebody under the bus.
Our floor director's always lifting, and you're always giving her the side eye.
Right? Trying to help. I'm trying to prevent some issues.
Yeah, but it's true. Like you got to use your knees, and you have to have your.
Yep. So when done right, it's perfect, but done improperly, it's gonna injure that.
So that's part of the problem. We have to learn how to do it right.
Yes.
We don't know. Where do you learn that? They don't have that class
you
in
can
school.
Find something online now.
Yeah. Okay.
It's called Google. That's lots of good stuff.
Oh, he's sassy today, ladies and gentlemen. Thank you so much,
you're welcome.
Dr. Paul. It's always great to have you.
Thank you.